America has an addiction problem, and today, in the first report of its kind, Surgeon General Vivek Murthy called for a major shift in the way we treat this. His report says nearly 21 million suffer from substance abuse. It affects more Americans than cancer. Yet 90% are not getting treatment. The economic impact is more than $440 billion. CBS News medical correspondent Dr. Tara Narula joins us now. Tara, do we really know how to define addiction?
The report does a great job at telling us that this is a spectrum that ranges from substance misuse all the way to the more severe form of the disorder, addiction. It's a call to action for a public health crisis that affects individuals, families, society. The number of Americans affected by substance use disorders is as many Americans as is affected by diabetes, more than 1.5 times the Americans affected by cancer. And yet, would we accept a treatment rate of 10%? For those diseases? Probably not. So the hope is that this will catalyze change, as did the Surgeon General report in the 1960s when it came to tobacco.
So, Tara, where do we go from here if this is to be treated as a disease?
One of the best things this report did is really tell us that we need to change our attitude about substance misuse and addiction. We need to have understanding and compassion that this is not a moral failure. This is not a character flaw. It's something, or not something to be ashamed of. This is something that is a chronic disease of the brain, and we need to treat it like a chronic condition. The faces of this disease, our family members, our colleagues, these people need to feel comfortable coming forward and telling us that they need help. And we need to approach this with a public health approach like we would treat any other chronic condition, which means mobilizing doctors, policymakers, educators, parents to really have a multifaceted attack. And the idea is that hopefully with that, we understand the science, we know that prevention and treatment work, that recovery is possible, that we can really do this as long as we put the effort in.
All right, Dr. Tara Narula. Thanks, Tara.